name is Grace Dirango. I work for HIAS as a project manager, and I was in charge of the Sexual Reproductive Health Rights Project for adolescent and youth refugees that was funded by HIVO's Southern African Fund. The project was designed to increase access to sexual reproductive health rights for refugees, including services such as HIV testing, post-exposure prophylaxis, and the pre-exposure prophylaxis. We were working in Nairobi County in 3 locations, that is Kasarani, Kayole, and Eastleigh.
HIAS works with urban refugees, and so we realized there was a gap in addressing the sexual and reproductive health rights of young adolescent girls. And so a proposal was developed, and that came about. And then, so we were working with the male population, again, as men being the leaders and the people who guide in society, because we do work with traditional societies. Then a lot of our focus was also dealing with religious leaders and the men in the community, and just to see how we can advocate for the rights of girls in accessing reproductive health rights.
So the activities that we did in this project included training the youth in comprehensive sexuality education so that they are aware of their rights, they are aware of their sexuality, and to demystify the whole issue of sexual reproductive health rights.
First, refugees, when they come into Kenya, some of them have little knowledge about their reproductive health right, of which when the project began, we were able to narrow down through community awareness and also educating youth about it.
I did a project on the topic SRHR, that's sexual reproductive health issues. First of all, I was educated about the topic itself, and then secondly, I was trained so that I could go back and teach what I was taught to my community.
We also had stakeholder forums, opening stakeholder forum to introduce this project to the community, to the refugee partners, to the government, and to the community leaders. We also had forums for advocacy training, because advocacy is part and parcel of scaling up the skills that we need in sexual reproductive health rights for the youth. And we cannot do this without working with the Nairobi County, because this is the area where this project is being implemented, and the health facilities that these youth refugees go to are manned by the Nairobi County. So we included the Nairobi County officials who drive the policy on sexual reproductive health rights.
Before we began that project, many girls got pregnancies, they got sexual transmitted disease, and they hide. So they couldn't go to the clinics to know what problem she has. But with this project, they have got enough skills to know their body, how it works, how to keep it healthy.
Another success that we had was a screening. We partnered with Family Health Options Kenya through the main partner for this project, who was the SRHR Alliance of Kenya. And they brought in FHOK, being the medical service providers, to provide screening for cancer, for STIs, for HIV/AIDS to the youth populations in Kawangware, in Kasarani, and in Eastleigh. And those who are found to have specific issues that needed more medical attention were referred to various medical facilities. We also had production of social media clips. Sexual reproductive health issues are not issues that young people will talk to with their parents. And so we felt that social media clips are very good ways of passing this information to more youth and learning it from their peers, and putting information on where they can access the different services on those very small clips that are attractive to them, use their local languages, and are short and to the point, and are circulated on the different social media platforms that the youth access.
We got to know different cultures. For example, there's how I perceive things, as in my our community perceive things is different from what other community perceives things. So we were told no matter how well you know things, it does not make you better from other people. You should try to educate the other people so that you go up together. The challenges were culture of the people, it's making it hard to accept whatever we are taught. Yeah.
One of the challenges we faced was that with the Somali community, the community leaders and the faith-based leaders felt that this project was going against their values, against their traditional cultural norms, and against their faith. So their participation was very minimal.
In their culture, young girl and young boy, they are not allowed to talk about sexual reproductive. Those challenges I managed to talk with their faith leaders to try to talk to their youth so that they may understand what the sexual reproductive is. When I talk to their faith leaders, they come up with an idea to come to the project.
We had one youth being elected to sit in the Nairobi County Working Group on Sexual Reproductive Health Rights to represent the refugee issues.
I was nominated to Sexual Reproductive Health Rights Committee for Nairobi County. We observed success we can mention was there is decrease of early teenage pregnancy among refugees. Gender-based violence has also reduced. And engaging mothers, young mothers about prenatal and postnatal. We were able to observe some young infants are becoming healthy. The issue of cultural type also has reduced. So there are more success about it. And refugees themselves were able to link together with Kenya to tackle the issues that are facing them.
I think the most successful thing about the project was when everyone came together. We were from different communities, different countries. Some people had idea, some people didn't have any idea about the topic. And when we came together, we were taught and other people shared their point of view because people got more information and they were educated.
Nowadays, I get call from different area to visit them in churches, in their places. This proves that they have known, they have been interested with the project. Especially those parents or those adults, they had problem of sexual violence in their shelters.
The training of the youth in comprehensive sexuality education, we had a target of 100 refugees. We ended up training 114 because there was so much demand from the South Sudanese community. And even after we finished that training, they said to us, we would want to be trained as trainers so that we can scale this up to our peers who did not get this training. And so we trained 50 of them as trainers of trainers.
What I just like to say it's a successful step is like if more of us are trained about this issue so that when we go back to the community, at least it's not the same face people are seeing. It's different. A lot of people are getting knowledge and information about it.
HIAS works in about 7 sites, but we only implemented this project in 3 sites because of the funding. And so when word reached the other communities that we were doing this project, there was a lot of demand. And that to us was a challenge because we felt that this project would benefit more youth in those areas. What we would have done differently for this project was to involve the Muslim youth, Muslim community leaders from the get-go at the design of the project, to start building rapport and for them to understand why this project was designed as it was and targeting the youth and adolescent refugees for their buy-in, because involving them at the stage where we were now implementing the project, where we were starting the project, we missed their buy-in, and that meant that a lot of Muslim youth refugees and adolescents did not participate in this project. What is next for HIAS Kenya and refugees SRHR is to build the capacity of refugees to advocate for themselves. When we look at the youth population in the refugee population in Nairobi, they have a lot of capacity to do advocacy, but then they do not have these skills. So we would want to build the skills to be able to do advocacy at a higher level, at the county level and at the national level, so that they can elevate the issues that refugee youth and adolescents face in terms of sexual reproductive health rights, and so that we can also build the capacity for them to do activities on sexual reproductive health rights as the community by themselves without even the involvement of partners or even HIAS being there.
In terms of working with youth refugees in regarding SRHR services would be that would be to scale up the activities. And fortunately, we have been given a second fund from HIVOS, and so we are going to do that. And also bearing in mind the lessons learned from the previous project, we're now going to be able to address those gaps more adequately.